Eating disorders are a form of mental illness and can happen to anyone at any age, including teenagers and children. Here with us to discuss is Lindsay Soucy, Sweetzer's clinical director of their New England eating disorder programs. Lindsay, thanks so much for joining us to talk about this important issue. What are the signs of possible eating disorders in teenagers, and can it happen to anyone at any age?
Certainly can happen to anyone at any age, unfortunately. So there are some kind of key areas that we encourage folks to pay attention to when we're looking for something that is concerning and problematic. So first and foremost, of course, changes in eating patterns. So we're looking for a decrease in eating, avoidance of eating in front of other people, especially I no longer want to eat with the family, I want to go eat in my room all the time. And things like avoiding foods that they used to enjoy. So I used to like this thing and now I'm saying I don't really like it anymore. Changes in behavior patterns. So this could be things like really rapid changes in irritability, social situations like avoiding being with friends or avoiding engaging in situations or engaging in behaviors and activities that they used to enjoy. Also, a lot of self-image focus, like really hyperfixation on what they look like, especially if what they're saying about themselves doesn't match what the guardian is saying. And then lastly, certainly physical concerns, so rapid changes in weight, things like feeling really cold all the time, dizziness, lightheadedness, and then anything that would come from the PCP or the doctor about concerns with heart rate or blood pressure, things like that.
Sure, and this could impact younger children as well. We're talking about teens, but maybe kids who are, younger than 10 years old.
Absolutely, yes. So that certainly is growing, unfortunately. And it might show up a little bit differently than it might in an adolescent. So younger children might present more like, I'm worried my stomach's gonna hurt if I eat. I'm worried about choking or getting sick. You might find hidden food. You might find that a kid is hoarding some food. You might find that there are other things like a lack of growth in their height or in their weight, delayed puberty for younger kids too. So it's happening all over.
It's got to be difficult for parents to kind of pinpoint an eating disorder, right? So how do they know, the difference between maybe having a kid who's a picky eater or something that might be a little bit more of a concern?
Yeah, so that's a really important note. And really what we're looking for here is that this is pervasive and consistent, right? So we're not talking about a kid who gets a little bit picky, but we'll try things once in a while. We're talking about a kid who is cutting out whole food groups, is really struggling at the table, really refusing a lot of things. It's really pervasive in that sense. And also that there's a really big impact on their lives in terms of their mood and their physical symptoms, and that we're seeing it as widespread in their lives, and they're having an impact on their overall life.
Okay, Lindsay Soucy from Sweetzer, thanks so much for joining us and talking more about this important issue with us today. We appreciate it.
Thanks.
Awesome.